A very good evening to you and a warm welcome to the news live on ChannelEye. I'm Sharifah Tahir.
Good evening indeed. I'm Charita Minapurarachi and let's move on to the headlines for tonight's news.
Travelling between provinces prohibited from midnight today. The President directs health officials to pay special attention on persons above 60 years and on persons suffering long-term from non-communicable diseases. The Army Commander says no persons above 30 years who have not taken both COVID vaccine doses will be permitted to enter public places after September 15th. Vaccination programs held at 297 centres island-wide today as well. Hospital authorities say that there is no truth on the report stating the number of deaths at Kalubovila Hospital. Exhumed body of Ishalini buried this afternoon.
We move on to those and other stories in detail now. Travelling between provinces has been prohibited from midnight today. Head of the National Operations Centre to Prevent COVID-19, Army Commander General Shavendra Silva said the decision was taken to prevent the spread of the pandemic. Only those who are engaged in essential services such as health, harbour, airport, agriculture and BOI-approved garment factory workers will be permitted to travel between the provinces. Public transport between the provinces has been suspended. When calling the staff of state and private sectors, head of the organisation has been empowered to call employees residing outside the province according to the requirements. Staff of private businesses establishments should be called following health guidelines considering space of the workplace. Meanwhile, Army Commander General Shavendra Silva said that after the 15th of September, all those who are above 30 years should produce COVID vaccine certificate with both doses to enter public places.
And meanwhile, President Gotabaya Rajapaksa has instructed health authorities today to pay a special attention to those who are above 60 years and suffering from non-communicable diseases for a long time. The President gave the instructions during a special COVID Prevention Committee meeting today at the Presidential Secretariat. And it was disclosed following inquiries about the deaths occurred during the past few days due to COVID, and most of them were from the Western Province. A higher percentage of them is more than 60 years of age and have not taken the COVID vaccine and suffering from non-communicable diseases. The President said that the priority should be given to persons above 60 years and having various illnesses when conducting PCR and antigen tests. He pointed out the need to isolate patients who have kidney transplants and subjected to blood dialysis. The need to pay special attention by medical officers of the public health inspectors about the patients who have registered at clinics in hospitals to get treatments for non-communicable diseases was pointed out. Army Commander General Shavendra Silva said that steps will be taken to identify who have not come to get the vaccine due to various illnesses and above 60 years and to vaccinate within next few days. It is not sufficient to get one vaccine dose to get protected from the virus. Therefore, consultant doctors of the COVID committee pointed out it is necessary to act with responsibility until the increase of immunization after taking both vaccine doses. The doctors emphasized it is the responsibility of the public to stay at homes, all those who are without special needs, and called duty following health advice to prevent the spread of the disease. Minister Pavitra Vanyarachi, State Minister Sisira Jayakodi, Channa Jayasumana, COVID committee members and health officials attended the discussion.
Vaccines had been given today at 297 centres covering 22 districts under COVID vaccination program. Meanwhile, mobile vaccination took place today for elderly persons and people with special needs in Colombo city. 11 vehicles have been deployed for the purpose. The vehicles have been operated covering Ballavata, Killapana, Colombo 3, Boralla and Colombo 7. An ambulance has been assigned to Colombo South. Persons who wish to get vaccinated from the mobile vehicle should get themselves registered by calling the National Operations Centre to Prevent COVID-19 over their telephone number 0112 860 002 or 1906. A vaccination program has been implemented at Valisara National Chest Hospital. Vaccines are being given to persons with various difficulties while they are in their vehicles. Vaccination of staff of Maharagama National Education Institute and lecturers took place today at its premises. Second dose of the Sinopharm vaccine has been given there. Sri Lanka Navy implemented a vaccination program today at the Lighthouse premises on Chaitya Road in Colombo. The first and second doses of Sinopharm vaccine have been given. Community Police Division of Sri Lanka Police and Health Division of Colombo Municipal Council implemented vaccination programs today at Mihijaya Sevana Randiya Uyana Community Hall in Mutwal and Dematagoda Vidyalankara Pirivana. Vaccines have been given to those above 60 years in the Colombo city and who have not received any vaccine so far. 15,689,167 vaccine doses have been given to the people under COVID immunization program. The Health Ministry said that 2,171,554 vaccine doses have been given to the people during the last 7 days. 334,020 vaccine doses have been given yesterday. The National Kidney Disease Centre says that patients who are getting treatment from Maligavatta Kidney Hospital subjected to blood dialysis and patients who have been transplanted kidneys can get the first vaccine dose at the Maligavatta Kidney Hospital. Accordingly, only relevant patients can get the first dose of the vaccine tomorrow and on the 21st from 8 a.m. to 10 a.m. Meanwhile, health authorities explained today about the changes in data of corona patients in the Gampha district. 2,382 corona-infected patients were found from the country today. 2,173 left hospitals today after recovering from the virus. 48 employees, including drivers, conductors and technical officers of Kasbah SLTB depot, have been infected with the virus. As a result, the depot was temporarily closed from yesterday. Ampara Regional Health Office, Police and Army conducted an operation to nab persons who violate health regulations in Ampara town. Weekly fare in Ampara town was closed temporarily from today. The Intermediate COVID Treatment Centre built for SLTB employees at Kaluthara Central Driver Training School was opened today under the patronage of State Minister Dilum Amanugama. The centre is equipped with 37 beds.
And the President of the Sri Lanka Medical Association, Dr. Padma Gunaratna, stresses that there is a need of reducing the number of admissions to the hospitals as the number of COVID-19 patients are rising in the country.
As it's known to all of us, there is a rapid rise of the number of cases that are getting admitted to hospitals. All hospital beds are getting occupied and the ICU beds are getting occupied. There is a rapid rise of the number of patients who need oxygen. Oxygen requirement of patients also are rapidly rising. Therefore, there is an essential need for us to reduce the number of admissions to hospitals. And also we see that there are a good number of healthcare workers who get infected as such that they keep away from work, so that there is a shortage of staff. Patients who are not with COVID, as all hospitals are going to reserve about 50% of hospital capacity for COVID patients, all the non-COVID disease entities also get severely compromised. At present, because of all these calamity, there is a need for a rapid reduction of the number of cases in community so that there would be some breathing space for hospitals to recover at least to some extent. As per prediction made by the WHO expert committee, if we could go for a severe mobility restriction for at least for 4 weeks, we will be able to save more than 18,000 people. I mean, we would be able to save 18,000 deaths by January 2022. So that, I think, as healthcare professionals, that is something that we are really concerned of. And as healthcare professionals, for us, there is no other option left at the moment other than recommending for a severe mobility restriction.
Dr. Harsha Sachishchandra says that corona patients staying at homes should pay a special attention about their symptoms. He said that if they experience respiratory difficulties, they should immediately contact emergency health services.
I want to give a small message to patients who have COVID-19 symptoms at home. Now, there are two categories. One category is patients who have been diagnosed to have COVID-19 and who are waiting till they are being taken to hospitals for further management. And also there are patients who have COVID-19 like symptoms. Now, we know the symptoms are like fever, dry cough, and phlegm in the throat, sore throat, and those symptoms. Now, of course, again, there are also patients who are on a home care management system. I think the Ministry of Health has initiated this. It's not widespread right now, but it is being implemented gradually in all areas. So there are patients who have COVID-19 symptoms or who are diagnosed to have COVID-19 who are staying at home. So a simple message to them, one is that they should rest at home. Although they are confined to homes, they should not exert themselves. They should not engage in activities which will make them tire themselves out. One thing that they have to be very careful of is whether they are getting short of breath. That may be at rest while they are sitting on a chair or while they are sleeping in the bed or washing themselves or some other minor activity. So if they feel short of breath on doing something, then what that means is that the oxygen level of that person may be going down with that activity, which is a dangerous symptom. It's a warning sign that the COVID-19 illness is progressing in that patient. So they have to inform the MOH or the PHI or even the GP if available that they are having these symptoms, and now with this home care system in place, there will be numbers given by the Ministry of Health. They can ring the call center and inform of that situation. A simple thing that they can do at home is that if they are okay at rest, of course, if they feel short of breath at rest, they should not do this test. But if they are okay at rest, they can take a few steps, maybe about 30-40 steps, come back and sit on a chair and see whether they feel short of breath. If they don't feel short of breath, then they are probably quite okay and their oxygen level must be alright. Another test that they can do is they can sit and stand for about 8 to 10 times within a period of 1 minute, and then sit and wait for a while, maybe 1.5 minutes to 2 minutes, and see whether they feel short of breath. If they don't feel short of breath, they are probably okay. But if you have any doubt that your breathing is not normal, you must inform the authorities. That is very important. And two other things that you have to do is you must drink plenty of fluids, about 2.5 liters of fluids per day, and you must take nutritious food. You may be a person with other illnesses like diabetes, hypertension, then you have drugs that are prescribed to you. You must take all these drugs. You must not stop taking these drugs, and you must get enough sleep as well. So those are the general things. If you have any doubt that you are not doing too well, if you have any doubt about your health condition, you must inform the PHI, MOH or the ministry call center.
And the police spokesman, senior DIG Ajit Rohana, says that COVID vaccination program, which is jointly operated by the Sri Lanka Police and the Colombo Municipal Council, will be continued at the Randiya Uyana Community Centre at Mihijaya Sevana Housing Complex in Modara.
The vaccination program organized by Sri Lanka Police Community Policing Police Division along with the officers of health authorities of Colombo Municipal Council is conducted today at the community centre Randiya Uyana, Mihijaya Sevana in Modara area. In addition to that, another centre has been opened at Vidyalankara Pirivena in Dematakoda area. If you have not been vaccinated so far, if you are a person who lives in Colombo city, kindly proceed to one of these vaccination centres for the first dose of COVID vaccine, and the community policing officers will direct you to the centres. We have deployed large number of police officers in respect of COVID-19 duties. 64 persons have been arrested in connection with the offences of quarantine rules and regulations for a period of last 24 hours. 30 persons out of 64 have been arrested in connection with the offences of face mask. In addition to that, total number of 54,100 persons have been arrested in connection with the same offences within a period of since the 30th of October 2022 date. Also, yesterday 318 persons have been sent back to their original places along with 161 vehicles as they were trying to cross the provincial border. 5 persons have been arrested along with 4 vehicles as they were trying to cross the border by using other ways that are connected between provinces, especially the Western province and the other provinces, and they would be produced before the respective magistrate courts today. We are going to implement the provincial restriction order strictly. Therefore, everyone is instructed to not to cross provincial borders unless it is an exceptional situation. In addition to that, we are conducting constant mobile patrols, roadblocks and other patrols in the border areas, especially in respect of provinces, in order to apprehend the persons who violate the provincial restriction order.
Deputy Director of Colombo South Teaching Hospital, Dr. Rukshan Bellana, says there is no truth about the reports on number of deaths at the hospital. He said that there is no overcrowding of patients due to increasing facilities for COVID patients. Dr. Rukshan Bellana said that all deaths reported are not COVID. There is no shortage of space. He said that certain people drop elderly people inside the hospital. CCTV camera footage shows that well-dressed persons coming and dropping them. There were 4 yesterday. He said if children think their parents are a burden, those problems can be solved through discussions with the Ministry of Social Services. Dr. Bellana requested them not to leave elderly persons like that.
Minister ChannelEye Rupavahini says that steps will be taken to remove teachers and principals' salary anomalies as mentioned in Vistas of Prosperity Manifesto. He mentioned this while taking part in Amathittumangin Ahanna Prosperity Development Dialogue at the Government Information Department today. Minister ChannelEye Rupavahini said that the problem of teachers and principals' salary anomalies is a long-standing one. Ms. Andapangoda commenced a trade union office in 2016 to 2017 after Sri Lanka Podujana Peramuna was established. They made a huge commitment in this regard. Trade union leaders of Sri Lanka Podujana Peramuna fought to remove salary anomalies. As a result, for the first time in the history, it was included in the election manifesto. It has been clearly stated in Vision of Prosperity program. It will be solved in a fair manner.
Ministerial subcommittee appointed to look into salary anomalies of teachers and principals and to make recommendations commenced discussions with teachers and principal trade unions. The discussion took place today at the official residence of Minister Vimal Weerawansa. The subcommittee includes Ministers Dallas Alahaperuma, Mahinda Amaravira, Vimal Weerawansa and Prasanna Ranatunga. First discussion took place with the members of Sri Lanka Podujana Education Services Union. Thereafter, members of the National Committee Against Teachers and Principal Salary Anomalies held discussions with the Ministerial Subcommittee. Sri Lanka Professional Principals Union held discussions this afternoon with the subcommittee.
The first Kumbal Perahara of Kandy Asala festival is parading the streets. The tusker carrying the sacred casket stepped out of Sri Dalada Maligava at the auspicious time of 7:18 p.m. Asala Perahara festival is conducted without the participation of public due to the COVID pandemic. However, all arrangements have been made to conduct the procession in a grand scale. Vasana Tusker of Ruhudu Mahakaturagama Devalaya carried the sacred casket of the first Kumbal Perahara. Singharaja of Sri Dalada Maligava and Burmaraja accompanied him. The procession will move along Sri Dalada Vidya, the Senanayaka Vidya, Temple Road, Deva Vidya and Colombo Vidya and thereafter return to Dalada Maligava through Raja Vidya and the Senanayaka Vidya. About 40 elephants are taking part in the procession with all cultural items.
රජවීදියට හැරී ඉහළට වී ගෙවදීමට නියමිතයි. සියලු සංස්කෘතිකාංගයන් සමගින් වීදි සංචාරය කරන පෙරහැරේ අලියතුන් 40ක් පමණ ගමන් කරනවා.
The body of Shalini Jude, who died with burn injuries while in domestic service at MP Rishad Badiuddin's home, was handed over to her relatives again today. The body was exhumed on the 30th of last month for the second post-mortem. The body, which was buried at the General Cemetery of Hatton Diagama Estate, was exhumed under the supervision of Nuvarelia Magistrate Lushaka Kumari Dharmakirti and 3 special judicial officers. After the second post-mortem conducted at Peradeniya Hospital, the body of the girl was handed over today to the relatives. It was buried again at General Cemetery of Diagama Estate in the afternoon. According to investigations into her death, wife of Mr. Badiuddin, her father, brother and intermediary have been remanded. Meanwhile, Chairman of National Child Protection Authority Mudita Vidanapatirana said today during a media briefing that a new circular has been introduced to prevent child abuse and to implement laws speedily.
Minister of Trade Bandula Gunawardena says that approval will not be given to register new paddy mills. During a media briefing at the Government Information Department today, the minister said that certain individuals are registering paddy mills as a strategy to gather paddy stocks. Minister Bandula Gunawardena said that if other parties except for Paddy Marketing Board and rice mill owners gathered paddy stocks with the aim of earning unreasonable profits, the stocks will be confiscated. The government has sent a circular banning registration of new rice mills. There are are 161 paddy stores in the country and details of all those have been gathered. He said that the government will confiscate paddy gathered by racketeers.
In the meantime, the procession carrying crest gem and pinnacle of Anuradhapura Sanda Hirusaya reached Tolangamu Rajamahaviharaya today. The procession carrying the religious items are scheduled to reach Kurunagala Baudha Loka Pirivana through Ambepusa, Alawa, Pambadeniya, Dampalasa and Naramala tomorrow morning. Devotees in Kurunagala and surrounding areas will be able to venerate the religious items tomorrow following health guidelines.
And with that story of Woolly Mammoth, we are going to wind up tonight's news. Do it just tomorrow at the very same time. Stay safe.
Safe.
Good night.